News there, but of course that outbreak in Africa 4 years ago caused more than 11,000 deaths. And with me here on set is Yazdanpanah, who's head of the Infectious and Tropical Diseases Department at Bichat Hospital here in Paris. He was also one of the principal investigators in a clinical trial in West Africa. Thanks very much for coming in and talking to us today. So we heard there from the World Health Organization. They do sound pretty optimistic, don't they, in this case? I mean, do you think that's justified optimism?
Yeah, I do think that the difference with the 2013-16 outbreak in West Africa is probably that we have more awareness and we have a larger amount of tools to fight against the epidemic, among which the vaccine.
I mean, there have been some criticisms, haven't there, that it's just been, so far, health professionals mainly who are being vaccinated against Ebola, even though a lot of the people who've come down with the disease may, of course, have been in contact with other people as well.
The first target population for the vaccination has been, as you said, health professionals, because they are the front line of the fight against Ebola, but also the contacts of ill patients with Ebola, and the contacts of the contacts. That is where last week WHO and the DRC government have started vaccination, and also MSF this week.
And that's enough, is it? I mean, we have heard some worrying stories. There were stories last week, I remember, of 2 people who were being treated. They were in a hospital and they left the hospital on their own devices to go to church because they felt that they would be safer being in church rather than being in the hospital.
Yeah, unfortunately, we have that kind of stories around Ebola because sometimes there are mistrust to the healthcare professionals, to the government, to the system. So we have that kind of protest, but we should fight against them. And as you said, it is very important to have this trust, and that's why I think anthropologists and social science researchers on the field will be very important.
And we've been talking as well about the fact that they're using an experimental vaccine. We had a very quick chat just before we came on air. You were telling me it's the same vaccine that you were using in your trials in West Africa last year.
Yeah, I think that maybe experimental is too strong, but the fact is that this vaccine is not yet on the market. But we have a lot of data with that vaccine. It has been used in the north for evaluation of the safety, and it has been also evaluated in African countries for safety, but also for the efficacy, because it was used in Guinea in 2014, 2015, and it shows that it was efficacious, decreasing the number of cases in the contacts. It was called the ring vaccination, and it has been published. So we have quite a large amount of data.
And in layman's terms, if that's possible, I mean, how is it different? What makes it unusual?
The vaccine?
The vaccine.
It is not really unusual when you compare it with the other vaccines. The difference here is that it is a kind of post-exposure prophylaxis, which means that if you have been in contact with a case of Ebola, if you get vaccinated very early, then you will not have the disease. It's one vaccination, this vaccine that is used, so it's one dose, and you will have the efficacy within 6 days. From data we have, there are not that much safety problems. Of course, you may have some mild issues, but not very important issues.
And what was the trial that you actually did in West Africa last year?
So the trial we're doing, so INSERM from France, NIH in the United States, and London School of Tropical Medicine in 4 countries, Liberia, Guinea, Sierra Leone, and Mali. It is ongoing, and it's evaluating this vaccine and also another vaccine that we'll start to talking for use in health professionals in DRC, which actually the main objective of this study is to look at the safety in children, because we don't have that much data, and the durability of the vaccine, how long the immunity lasts. And the idea is to follow that for 5 years.
And how worried, more generally, should we be concerned about with Ebola? I mean, obviously we've had one big outbreak a few years ago. We've now got this smaller one as well. But is it still something which is going to keep coming back? We're never going to get rid of Ebola.
So you're right, because in DRC this is the 9th Ebola epidemics. Most of them were small epidemics. That's why that we have, for example, INSERM, but other French institutions like ERD, working on the field with people from DRC, with researchers from DRC to try to see what is the reservoir of the Ebola, why it's coming back. And for that, try to find out whether animals can transmit, what can transmit, and fight against that. So we're currently working on that in DRC in particular, but also in Guinea, but also in Cameroon, to try to see what are the variables that impact transmission to try to fight against that.
And do you think we'll ever be completely rid of it?
I cannot say that kind of thing because I don't know, but we will try.
Okay. Thank you very much for coming
Thank you
to us today. Yazdanpanah from the Bichat Hospital here in Paris.